Cristina Cleghorn. I'm based here at the Department of Public Health at the University of Otago, Wellington. And I'm going to be talking about New Zealand diets optimised for health, cost and greenhouse gas emissions. This is some work that I've done with Professor Cleona Namuchu and Dr. Nung Naim, and it's funded by the Healthier Lives National Science Challenge. So there's a little bit of overlap with Bruce's presentation in terms of the data that I've used and some of the messages, but hopefully you'll find something interesting in this one as well. So background is this came out of also the publication that the Eat Lancet Commission put out in 2019, where they proposed this great food transformation where they brought the 6 planetary boundaries that are associated with food production into a safe operating space. So that's greenhouse gas emissions, biodiversity, fresh water use, land use, nitrogen and phosphorus cycles. And they developed a global reference diet high in vegetables, legumes, whole grains, fruit and plant sources of protein and low in animal sources of protein in order to achieve this great food transformation. So that paper was global, of course, and what we wanted to do was look at something similar in a New Zealand context. So we aim to develop a New Zealand specific diet to bring the planetary boundary of greenhouse gas emissions only, unfortunately, under a safe operating threshold. And this diet also met the population dietary guidelines, and we aimed to have the cost of diet to be under the baseline cost of diet in New Zealand. So to do this, we used optimization methods, which use linear programming, which apply a number of constraints and provide you with an optimal solution based on the constraints that you've set. To do this, we did this in Excel using a solver add-in, and we optimized for the 4 demographic groups that I've listed there. So we can go on in the next stage of the project to model the impact of following that sustainable diet in the New Zealand population. So the main optimization constraint was to both minimize the New Zealand greenhouse gas emissions associated with diet and also to keep the greenhouse gas emissions under a specific threshold. So this threshold was based on a report that was commissioned by the Ministry for the Environment, where they translated the planetary boundaries to a New Zealand context. And the figure that we used was the amount of greenhouse gas emissions that should be associated with the food system in New Zealand per person per day. The second constraint was meeting the recommended daily intakes for 24 nutrients. So that was fiber, polyunsaturated fat, protein, 17 different micronutrients where we optimized the diet to be above those intakes, and then 4 nutrients where we optimized the diet to be below maximum guidance. So that was for total fat, saturated fat, sugar and sodium. We also had a criteria in there to meet the New Zealand food-based dietary guidelines, which had guidance on adequate intake for fruits, vegetables, grains, milk and dairy, and a maximum for red meat intake. We also had a criteria to keep the intakes between 90% and 100% of the baseline energy intakes. And for that, we use the National Nutrition Survey, which is from 2008-2009. So not the most up-to-date data, as Bruce has pointed out. And finally, to be less than the baseline dietary costs. And again, that's using the National Nutrition Survey data linked to 2011 NutriTrack data. Oh yes, sorry, not the final one. So once we'd optimized for all those criteria, we were finding that we were getting some really high intakes of certain foods, for example, carrots and yams. So we introduced another optimization criteria. So when a food group was optimized to more than 2 portions, then we pulled that back to be no more than 1 portion per person per day. So this is what the characteristics of this average diet look like. So this is averaged over those 4 different demographic groups I introduced earlier. So the greenhouse gas emissions came in under the 1.9 kgs of CO2 equivalents, which was the threshold that we plugged into the program. And that was about 54% of the baseline greenhouse gas emissions. Cost of diet was about 80% of baseline costs. And you may note that that looks like quite a small amount of cost of diet per day, but this is in 2011 dollars, so it will be a bit higher with current figures. The energy intake on average was the same as the baseline energy intake, and the total weight of food, which excluded non-alcoholic beverages but did include other liquids such as milk, came in at 20% higher than baseline amount of food, and that indicates that the optimized diet was less energy dense than the baseline diet. So this is what was included in the optimized diet. So you've got the green bars for the optimized diet, and the blue bar is for the baseline diet as comparison. So you can see that for fruits, vegetables, dairy products, you have high intakes, more than what we have in baseline. Bread, potato, kuruma taro, milk, and grains and pasta, it's a moderate amount. And for grains and pasta and milk, you can see that it's actually lower than baseline intakes. And the diet also includes some intake of those other food categories, fish and seafood, nuts and seeds, and strangely, pies and pasties. So you may notice that a lot of foods were missing from the optimized diets. So this is the same graph at the bottom, but at the top we've got what's in the baseline diet. And the significant foods missing from the optimized diets are most of the meat products, meat categories, cheese, eggs, bread-based dishes, and foods that are high in sugar or highly processed. This is the top 10 broad food groups. So you can see that I'm just being put off by the camera as well. You can see this is with the 4 demographic groups. So you can see that they don't vary that much between the demographic groups, which isn't actually that surprising when you consider the constraints that we've put in place. And you can also see that the pies and pasties are just optimized for males. And I think that that's probably in there because we've got the energy intake constraint. So far we've been looking at the broad food categories, and there's about 30 of those in the National Nutrition Survey. Underneath those 30 categories, we've got 340 different more specific food groups. And so this is the foods that have been optimized more specifically. So most of these food groups are actually fruits and vegetables, but we do have calcium-enriched fluid, which is milk, and soy yogurt and dairy-based dips in there as well. And you may also notice that some of those food groups, they're identical for the 4 different demographic groups, and that's because of that feature where we've capped the individual foods at 1 portion. So number of strengths and limitations, it's New Zealand centred, using New Zealand constraints, and it considers multiple constraints at the same time. Limitations, this only produces 1 optimised diet, so it's not very representative of how people actually eat differently every day. The number of constraints was limited to 200 in Excel, and we could have used with more. Baseline diet and cost data is from 2008 to 2011, and this work so far doesn't factor in cultural acceptability. But that is the next stage of the project, where we're going out to speak to people about what are the non-negotiables in diet, what do we actually need to see in these sustainable diets. So we're going to be re-optimising after that piece of work. So in conclusion, New Zealand diets that meet the dietary recommendations, so that's food-based and nutrient intake recommendations, that produce permissible amounts of greenhouse gas emissions and that are low cost, are feasible. They tend to be high in fruit, vegetables and dairy products, moderate in bread, potatoes, kumara, taro, milk and grains and pasta. And they do contain these other food groups: fish and seafood, nuts and seeds, and pies and pastries. Probably not always. And they tend to be low in meat and highly processed foods. So these results are in line with international evidence that healthy and sustainable diets need to be more plant-based and lower in processed foods than current patterns.